Hi, my dear student. Today we will discuss sinusitis. It means inflammation of the nose and paranasal sinuses. Duration less than 4 weeks. It's called acute. Subacute between 4 to 12 weeks, while the chronic more than 12 weeks. Acute sinusitis, as the regard of etiology, it may be rhinogenic, dental, or traumatic. Just mention two examples for each, like acute viral rhinitis in rhinogenic cause, dental infection because of intimate relationship between the maxillary sinus and the tooth, especially premolar tooth and first molar, or trauma due to the presence of foreign body. Cause of microorganism is Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis. What we mean by clinical picture, it can be divided into symptoms or what the patient complain of, and signs, what the doctor or physician see in the patient. So, as a regard of the symptoms or the complaint of the patient, he may come from thick colored nasal discharge, facial pain or pressure, post nasal drip, fever, fatigue, nasal obstruction, headache, hyposmia or anosmia. The facial pain, according to the sinus, in the maxillary sinus, the pain felt over the cheek and may be referred to the teeth and ear. In the frontal sinusitis, the pain may be in the area of the forehead. In the small sinusitis, between the both eye, while in acute sphenoid sinusitis, retrobulbar referred to the occiput. Signs: edema, mucopurulent nasal discharge, tenderness, erythema and edema over the involved sinus. How to treat this patient? Any treatment divided into either medical or surgical. Medical treatment, treatment of the cause by antibiotic if it's infection by bacteria. Symptomatic treatment means if there is a pain, give him an analgesic. If there is a fever, give him an antipyretic. If there is nasal obstruction, give him oral nasal decongestant. Local decongestant also can be used, but in acute rhinosinusitis, it's a medical disease. But in the presence of the complication or the patient not resolved only by medical treatment, we may do surgery only in complicated case. As regard of the chronic sinusitis, it's similar to the acute, but the duration more than 3 months or 12 weeks. It has the same diagnosis, the same symptoms, the same signs, except for the duration. So the patient may come complain of nasal discharge, nasal obstruction, headache, facial pain. Vacuum headache, this terminology is very, very important. It's intimate to the frontal sinusitis. Okay, it's due to this pain increase in the morning and decrease gradually over the day due to the closure of the sinus ostium with absorption of the air from the sinus creating negative pressure. So it's called a vacuum. Vacuum means negative pressure. Okay, due to the absorption of the air from the sinus. Other symptoms including hyposmia, halitosis, otitis media, pharyngitis due to the spread of infection. Physical examination or the diagnostic nasal endoscopy like the acute, but for more long duration, purulent discharge, edema, nasal polypi, deviated septum. But to be sure from the diagnosis, radiological examination is very, very important by CT scan. Treatment of chronic rhinosinusitis, medical also or surgery. Medical, give treatment of the cause by antibiotic, and symptomatic treatment by antihistaminic, mucolytic, analgesic, local decongestant, saline nasal irrigation, local corticosteroid. In the case of the failure of medical treatment, we can do surgery. Surgery means nowadays we do functional endoscopic sinus surgery. Functional endoscopic sinus surgery means widening of the ostium of the sinuses by the endoscope. It's called functioning because we don't create a new opening or another opening for the sinus. We just widen the original ostium of the sinus. So it's called functional endoscopic because we can use endoscope for doing it. And